Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
X-ray features or X-ray features of the rickets. In X-ray features of the rickets, we have fraying. Fraying is the zone of provisional zone loss of provisional zone of metaphysis. In fraying, there is loss of provisional zone of metastasis. Metaphysis in fraying, there is loss of provisional zone of metaphysis, and we also have cupping and splaying. In cupping and splaying, there is protrusion of the bulky cartilaginous cells below in a poorly mineralized metaphysis, leading to cupping and splaying. Splaying is widening is seen. The best way to assess the response to vitamin D therapy in nutritional rickets is by X-ray. Other investigations which can be done in rickets are serum calcium is decreased or normal, serum phosphorus or phosphate is decreased, alkaline phosphate is increased, parathormone is increased, 25 hydroxy vitamin D is decreased. Additionally, other investigations like 125 dihydroxy vitamin D3, serum creatinine, and serum electrolytes can also be done.
thank you and thank you for watching.